Okay, so welcome to the Keto Lifestyle Podcast, Dr. Anna Cabeca. How are you, Dr. Anna?
It is a thrill to be here with you, Jessica. I'm doing just great.
That's awesome. So I am so happy to have you on here and to share you with my listeners and those watching this YouTube video, which will be out there. So can you tell the listeners a little bit about yourself and just let them get to know you?
Well, thank you. I actually live in St. Simon's Island, Georgia, which is a small island off the coast of Georgia, below Savannah and above Jacksonville, Florida. So I came here actually as a National Health Service Corps scholar. I had grown up in a small town in Pennsylvania, and I had dreamed of being a doctor. I knew that women's health and women in medicine were a scarcity, as well as research in women. And I definitely wanted to fill that gap. And so that led me into medicine, into the National Health Service Corps, and then here in St. Simon's Island, Georgia, where I had a solo practice for over 15 years. And it has been quite a learning opportunity to be able to be really creative in how to empower women to heal their body, take charge of their health, and that it comes more, it's more than about a prescription pad and a knife, a surgical procedure. It has a lot more to do with being the CEO of our health, being the CEO of our bodies. And as much as I've known as a gynecologist and obstetrician, and then additional board certification and trainings, I recognize that it takes more than hormones to fix our hormones. And that led me to write my books, The Hormone Fix, and now Keto-Green 16. Being 53 with a 12-year-old, a child, I was diagnosed with infertility, Jessica, when I was 39, and early premature menopause. And so I've had a journey in healing my own body to then have a healthy baby at age 41 and reverse menopause. And so really am passionate about our body's capacity to heal itself and giving us the right tools in order to do that. And it takes more than hormones to fix our hormones.
Yeah, it does. That's awesome. Well, I love that you are, I think oftentimes we think, doctor, especially, you're a triple board certified doctor, correct?
Yes.
So a lot of times we hear that and we think, okay, great. So what pill are they going to prescribe? What procedure are they going to tell me I need to have done? And I love that you are very much not of that mindset at all. You really have gone after the education to get to know what we need as far as nutrition and other lifestyle. What has kind of driven you over the years to do that instead of just kind of following the same old?
Really, it was my journey. I needed answers because at 39, when I was diagnosed with infertility and menopause, and even before, my mom passed away undergoing her second heart surgery when she was 67 years old and way too young. And she had been struggling for 15 years, had her first heart surgery at 52, younger than I am now. And I just had grown up with this and thinking, okay, there's got to be a better way. I mean, what's the missing piece? I need to learn it. And so when I had that diagnosis when I was 39, I had to find a solution because my doctor's bag was empty. So literally, I traveled around the world. I took a sabbatical from my medical practice for a year, and I traveled around the world. And I did not discriminate on healing modalities. I did not discriminate on specialty avenues, right? Like certain times in America with our medical training, it's like, okay, well, the internal medicine gets this piece. The neurologist gets this piece. The cardiologist gets this piece. And everyone's so singularly focused. Now, as an obstetrician gynecologist, we get all of you, especially when you have a baby, right? We do get all of you. And I took that to heart being in practice in a small town. I was often the end-all be-all for these patients, and I was the only bilingual doctor, female doctor at that time, an obstetrician. And so, the clients didn't have anywhere else to go. I had to find answers for them. I had to find answers for me when my doctor's bag was empty. So I didn't discriminate. And I listened, I learned what works for me and what doesn't work for me. And let's see, would that work for you too? And lo and behold, as I started implementing the work that the experiences and lifestyle hacks and nutritional and functional hacks that I used for myself and used them with other clients, this it really changed my practice. I mean, we went from doing 2 to 3 surgeries a week to 2 to 3 major surgeries a year. Our bodies have a tremendous capacity to heal. And if we can keep all the organs God gave us, Even better.
Mm-hmm. Oh man, I couldn't agree more with that. I love that. I love hearing that, because I feel like so often you hear people go in, they have something going on and the doctors are so quick to just say, well, you don't need that organ. Just go ahead and take it out. You'll be fine. And that's a real big problem. I know, especially with women, in getting, our female organs taken out, much too early.
Right.
So
Right. Absolutely. I always said, how many penisectomies have you heard happening? Right.
yes.
Not so much.
Mm-hmm. Okay. So you were, so this led you to, you're exploring, you're trying to figure out all these other modalities, which I think would have been probably very interesting, traveling around and learning all of these things. So obviously at some point you became very enamored with nutrition and understanding or realizing that, hey, I think this nutrition has a lot to do with what's going on. Probably with a lot of things. I'm assuming that you probably were looking at that and thinking, wow, even with your mom's health and things that could have been done that perhaps weren't told to her, in those times. So it probably really kind of propelled you forward in that, I'm assuming.
Absolutely. I mean, my mom was following the American Diabetic Association diet. It took her down, right?
Yeah.
And so that was eye-opening for me because I had to understand what was different in her health versus, we're immigrants she was an immigrant to this country. I was born here, but her brothers and sisters who stayed in their native land, they're still alive, right? She's now passed away 22 years ago. And our other brothers that came here also died earlier than their siblings that stayed in a war-torn area of the world. So it made me, I've had this perspective like, okay, well, what's going on here? Well, for my mom's case, she was on 11 prescription medications when she died.
Wow.
I knew I wasn't going to do that to anyone, let alone to myself as part of my own journey. But I mentioned that I reversed menopause when I was 39. Well, then at 48, I still had, and I talk about this in my books, in the Hormone Fix and my new book, Keto-Green 16. I really wanted to get Keto-Green 16 out. Now, really, everyone needs the Hormone Fix. I promise you, you will love it. It is my manifesto.
Have that book, and I recommend that book to so many clients.
Thank you. Thank you. It is information I want every person to have. I didn't have this information. I had to find it and I had to create it and I had to put it in a way that we can all follow and understand what's happening to my body, what's happening to my mind. Well, and at age 48, I was going downhill again. To share a little bit more about my story, when I was 39, we had a tragic accident in our family and a significant trauma and, was definitely affected for, of course, everyone in our family was affected. And as part of that learning, not just to heal the body, but to heal the mind and the spirit and do the soul work that I needed to do was really, really critical. But as I continued on in this journey, I was able to heal my physical body, but yet there was a component of underlying trauma, PTSD, that was continuing to run. And when we hit this perimenopause, menopausal time period, those of us who have had post-traumatic stress, have had adverse childhood experiences, have chronic everyday stress, we do this transition poorly. We have more symptoms as a rule, more anxiety, more depression, more brain fog, more hot flashes. Just name it. We have these symptoms. Well, that was happening to me. And I experienced, Jessica, what so many of your clients will tell you, and my patients told me, my patients would come in and say, Dr. Anna, I'm gaining 5, 10, 20 pounds and I'm not doing anything different. And I'd be like, yeah, sure you're not, right? Like, how is that possible, right? Well, that was me at age 48. I lost and kept off 80 pounds. I'd been well over 240 pounds at one point in my life and kept this off. And I wasn't doing anything different. So why that weight gain? It was very interesting and terrorizing, right? Because if anyone listening has lost a significant amount of weight and all of a sudden it starts creeping back on, you're like, it's not going to stop till I'm over 300 pounds. What's happening here? And that's how it was for me. And so I immediately started doing very low carb, very keto, following the keto approach, because I've used it in patients with seizures, including one of my own children with seizures. And I've used it in women with, other neurologic issues, as well as Candida yeast. And so I just didn't feel good. And I recalled my perimenopausal patients, many of them going keto. So now I hit a wall. I don't feel good on it. Well, I experienced, because I was always very functional at this point, I experienced what I call keto crazy, irritability, agitation. And you can't do that for me at that time, a single mom, both mom and dad to my kids, because my ex-husband at this point had a traumatic brain injury. So again, trauma on trauma on trauma. And I knew I had to fix this fast. I mean, I lost a couple pounds right away, but I couldn't stand the side effects. I had to understand what's happening, Jessica. And that brought me back into my functional medicine training, where I looked at, okay, we got to just check your urine pH. How alkaline are you? What's going on? And I was as acidic as the urine test strips would read, right? And so I just started implementing more of the greens that I talk about, the alkalinizers, the low carbohydrate, dark leafy greens, and alkalinizing vegetables, as well as increasing the amount of Mighty Maca Plus is what I use. Mighty Maca Plus every day, apple cider vinegar, lemon, adding in some baking soda even, just to really start shifting my physiology so that I could see a more alkaline urine pH. And one thing I noticed, Jessica, so that shifted me into my whole Keto-Green approach, because within weeks, I lost the 20 pounds that I'd gained. I felt better. I have what I call energized enlightenment, clarity. The brain fog lifted. I had my memory back that I felt I was losing, and just reversed all of those symptoms. And I had this peace that surpasses all understanding. We talk about that in the Bible, the peace that surpasses all understanding. Man, I had that peace, and nothing else had changed. I still had 3 girls in my house, one in elementary, one in middle, one in high school. That still was chaotic, but I had this peace, lost the weight, felt better. And I recognized too, Jessica, this is why I think it's so important to understand it's not just about what we eat. That's a part of it, but it's not just about what we eat. So the mornings I would walk on the beach or do my gratitude journaling, I would have more alkaline urine pH all day. And come to find out, because I have to understand why this is, cortisol increases urine acidity. So that makes sense. So we can use our urine pH and ketones, honestly, as a barometer for how well we're doing. Mm-hmm. And identify things that are working for us and working against us. So at that point, when I was 48 and I started seeing the scale rise, I was like, not myself, brain fog, irritability, all that good stuff, shifting that into what I call now my Keto-Green approach. That just has shifted everything. From that point, I couldn't even have imagined how I was going to, continue my career, let alone write 2 books, develop 2 online programs, and be at this in the best relationships in my entire life, especially with my children.
Wow, that's awesome. Yeah, I definitely advocate. I've always advocated, not for the same reasons that you're saying. I never really thought about it that way, but I've always advocated, especially for women, that we don't cut the carbs out of the veggies. Like telling, people say, well, I'm doing the, I want to be keto and I'm eating this way, but I realize I can't really have veggies because those are carbohydrates. And I'm like, no. I want you to eat your vegetables. This is so super important for women, I find, especially. And what you're saying is making sense. Is perhaps that is part of the reason why I've always seen women do better incorporating lots of leafy greens specifically into their keto diet.
Yeah, absolutely. And that's why we created the Keto Calc, because for my keto calculator, you can adjust it. I mean, it's adjusted based on your height, your weight, basically your BMI, and also your activity level. And if you want to gain weight or lose weight, but you can see, okay, how does this look like for you in a day? What does Keto-Green in a day look like for you based on your, gestalt of your total caloric intake and your macros broken down into visuals of here's some recipes, here's a Keto-Green day for you.
That's great, because that's a lot of people have a really hard time figuring that out. That might be one of the most requested things I get is, can you just tell me exactly what to eat every day? Just give me a lineup, give me the recipes. We should send somebody to my house to make it all for me.
Oh, please sign me up for that too.
Me too. Because that can be the hard part, is just figuring out, like we can hear somebody say to us, okay, eat here's your macro breakdown, but then actually knowing what foods fit into that can be kind of challenging for people.
Mm-hmm.
So I'm looking at some of the questions that I had for you, and some things that I wanted kind of for you to talk about. You were kind of touching on that neuroendocrine connection, how it's so important that we are making sure that we really are fueling our brains well, so that our hormones are functioning properly, and kind of really vice versa, that our hormones are functioning properly so that we are fueling our brains right, and we're not getting these things like the migraines and mood swings. And I used to call it keto crazy. I just say I get mean. My kids will tell you that I'm much quicker to kind of fly off the handle or get upset over something that's not really that big of a deal, that maybe wouldn't normally upset me. So can you explain a little bit more about how that works, and why what we're fueling our body with really does affect our brains, and how we're able to function?
Yeah, and this is really what I'm passionate about. And that's why with Keto-Green 16, I really pushed the program a bit more, again, simplifying it too. But as we get older, first of all, our brain uses glucose for fuel on preference, right? That's the quick fix, going to use glucose for fuel. And in our standard American diet, we're always using it. But that ability for our brain to use glucose for fuel is an estrogen dependent phenomenon, which is fascinating. Now, men have I think it's like 6 times more circulating estrogen in their brain than women, because they're not depending on their ovaries for the production of estrogen. We are a large part, and as our ovarian function declines, as we hit 35, 40, our ovarian function is declining. Mm-hmm. And we get a steep dip of progesterone, which is a precursor hormone to our steroid hormones like cortisol, then down the line, estrogen and testosterone. So you can imagine, here we need progesterone. Progesterone is going to be used to make cortisol, right? And we also have to have DHEA, which is from our adrenal glands predominantly. And so that is needed to produce our estrogen and testosterone too. So if we're stressed, we're really plummeting our estrogen, our hormone levels, in our reproductive hormone levels from, optimal levels to substandard levels. And I really believe progesterone plays a big role in this. We just don't have enough of that research yet. But when we look at the curves, like how our brain is using glucose for fuel, when we hit this perimenopausal time period, it is significantly starving. So we have to shift, excuse me. We have to shift from using glucose for fuel for our brains to ketones for fuel. Mm-hmm. So think of glucose as gasoline and ketones as jet fuel. So it's even better, right? It's even better for our brains. And that's why I want people to get into this Keto-Green combination. And I've lectured, Jessica, for large keto audiences, and I'll ask how many people are keto, and the entire room will raise their hands. And then I'll ask them, how many of you test either blood or urine or breath testing for ketones? There's 3 different ways we can test. And maybe 10% of the room will raise their hand. We have to test, otherwise we're not doing it right. I do it myself. I've been doing this for a long time. And yet, I still have to periodically test and make sure, okay, am I keto-green? I like to I like the flexibility. I like to flow into and out of ketosis. Mm-hmm. So I like to stay there about, 80% of the time. Sometimes it's more like 60% of the time, but 80% of the time. And we do that not just through high fat meals. We do it through intermittent fasting, no more snacking, and creating insulin sensitivity, which definitely lowers and reduces inflammation. We feel more energized. We feel more clear. We feel more fluid. We have the interest in doing things that have probably been our to-do list for a long time. And now we just start checking off those things.
Yeah. So that is something that I talk about all the time with my clients when they're coming to this lifestyle for the first time, is trying to help them understand that not snacking and keeping the insulin levels down is really ideal. Can you talk a little bit about the connection between cortisol and how that can affect your insulin levels, your blood sugar levels, and therefore your insulin levels, and just kind of how that whole interplay is between cortisol and insulin, and why people even need to be worried about not snacking or not raising insulin.
Oh my gosh. So insulin, that is probably our biggest marker of disease right now. We know that as we become more, we just naturally become more insulin resistant as we get older. So that happens to us naturally, unfortunately. And so we have to do the lifestyle habits and hacks that make a difference. So dietarily cut out, stay very low carb, cut out the sugars. I will say sugar is a toxic boyfriend. So you got to break up with him for good because he's not good for you. And so that's how I look at sugar for the most part, right? And so when we are looking at, when we have stress in our life, we're going to increase our cortisol, and cortisol stimulates glucose release. And then we have to get insulin on board to bring that glucose down. Now, one thing I've done in my book, in Keto-Green 16, I use the Freestyle Libre, which is a 14-day blood sugar monitor. It actually measures the interstitial sugar in your tissue. And so we get an idea of what's going on. So it was really aha for me. There were some aha moments here. We know that coffee shouldn't take you out of ketosis, but what I was finding out that I'd wake up in ketosis, still be fasting, have a cup of coffee, and I'd be out of ketosis. And I'd be like, what's going on? And I started doing the 14-day blood sugar monitoring. Well, when I get up in the morning and I do my meditation, I do my gratitude journaling, all's good. When I get up in the morning, I have my black coffee and I'm out the door, my blood sugar raises 20 to 30, sometimes more,
Wow.
20 to 30 points or more. So that is just because of the caffeine stimulating glucose release. And so that's fascinating to me, is how this can happen to our body. So if we're not testing, we're just guessing, and we need to fine tune it for us. So this morning, for instance, I woke up, I had an herbal tea, and I had my greens first thing in the morning, did my gratitude journaling. I'm trying to make it through the Bible this year. So doing it with a small group, and that just, my physiology is better. Like the day is better when I start the day that way, and then break fast with a good Keto-Green meal. But when we are constantly pushing out cortisol, pushing out or stress, we don't have to take in sugar to raise our glucose. We really don't. So that's critical to understand. So we have to do these lifestyle habits and nourish our body in a way that reduces cortisol. And cortisol will create acidity, actually, because cortisol affects our kidneys, our renal tubules, by secreting hydrogen ions, which is a measure of pH. We're measuring the hydrogen ions essentially in our urine. So the more acidic we are, the associated, I would say, acidity is like a city, like New York City. Think of high industry, and it's a pretty inflammatory. And alkalinity is like the Amazon. Think of, the Brazilian Amazon jungle and waterfall in the background, lush greenery all around and beautiful flowers. I mean, it's really kind of relaxing just thinking about that. And so, alkalinity is that. And we know from research, many research articles, and I publish them in my book too, reference them, that the urine pH 6.5, 7, 7.5, in that range, when we're able to maintain that, we have better bones, we have decreased risk of diabetes, high blood pressure, and other metabolic syndrome. And that's important to understand, because it's not, again, just about what we eat. It's about how we're living, what stress is in our life, and it can show us so much more and help us guide our journey even better. But we have to create that insulin sensitivity so that we decrease our inflammation and protect our brain, protect our bones, protect our, every part of our body.
Yeah, I totally agree with that. I think that's really great. I work really hard on trying to get people to understand the stress component, and that it can't just be about what you're eating or what you're not eating. You really have got to focus on trying to manage that stress. And I am also trying to get through the Bible this year. Got a little group going, and we try to encourage.
Awesome.
So I do it on on the Bible app, the U version. I don't know if you're familiar with that, but it's pretty cool. You can actually link to other people, and
Oh,
so
that's awesome. I'm going to have to look up that one. What's it called?
it's called the U version, YOU.
Why are you? Okay.
Yeah, and it's just a little app, and you can invite friends that are on there too to join it with you, and it actually will step you through the Bible in a year. You can set up a plan to do that, and so we've done that. And then depending on what, not all of the versions will allow you to do it, but depending on what version of the Bible you're reading, you can just hit the play button and it'll read it to you. So that's usually what I do. So I will have it read it to me when I'm in the sauna or the shower or whatever, getting ready in the morning. And so I have to admit that I miss days quite often. And so that I'm trying to catch up on like 2, 3, 4 days at once. And it's really nice to just have it read it to you.
Oh, that's great. I'm going to download that for sure. Cause awesome. I'm a little behind my group too.
I am too. Okay, so I wanted to touch a little bit on, you were talking about intermittent fasting. You mentioned intermittent fasting. So whether someone is calling that intermittent fasting, or they refer to it sometimes as like a feeding window. Can you talk a little bit about that, and what do you recommend? What do you think works really well for women?
Yeah, so women work well by stopping dinner between 6 to 7 a.m. or finishing dinner by at least 6 to 7 p.m. Finishing dinner by 6 to 7 p.m. And then in Keto-Green 16, I have you work up to a 16-hour fast. So by breaking fast around 10 a.m. And there's a reason for this. Now, in the morning when you wake up, I want you to hydrate completely, drink an alkalinizing shot. Just to get the toxins out of your body as quickly as possible. They've been storing, releasing, and your body's been doing what it needs to do while you're sleeping.
So when you say that, are you referring to maybe like apple cider vinegar in water, or like some lemon water or something like that?
What I do a shot of my Mighty Maca Plus. So, because it has over 30 superfoods that are detoxifying and works together. So I use that with, a small amount of water, typically 4 ounces I like to do in a shot. And I'll either put the apple cider vinegar in it, or just drink the apple cider vinegar, just like a teaspoon to a tablespoon of it separately. Sometimes I'm just really lazy and I'm just going to drink it out of the bottle. Okay. No one else is using my apple cider vinegar bottle, but I'm totally doing that. And so that's how I'll kind of do my morning, and have a herbal tea, and I may or may not put MCT oil in it, and go from there. So that for me works really, really best. And now I've run thousands of clients through my program, and it really works best, especially for those of us over 40 where it seems like nothing works anymore.
It's really, I like that, that you're talking about having women stop their dinner a little bit earlier too, like cut off their eating window before a little earlier in the evening. I don't know if you saw, but there was recently a study that came out of Vanderbilt, just February of this year, 2020, where they had it was a very small study, but they did look at 2 different groups of people, and one of them was eating later into the evening. They started eating later in the day and ate later into the evening. And then the other one started earlier in the day and stopped. I think it was around 6 o'clock or 7 o'clock in the evening. And the second group that stopped earlier, they had a fairly significant more fat oxidation. And I think I don't know about other women over 40, but for this woman over 40, I am really happy to get a little extra fat oxidation. I want that boost of fat burning,
Yes, absolutely. And actually research shows that if we eat after 7 p.m., our body's secreting 30% more, up to 30% more insulin for that same meal if we ate it earlier. And the reason is because in the evening, we're like storage mode. I've got enough storage. Not enough, right? And the other thing you had mentioned, feeding window. I want people to break fast, right? And so I technically, like, my lunch is our break fast, and then have a good dinner. I don't like snacking in between. We have to get away from snacking in between because every time we eat, we're secreting, glucose, we're requiring digestive processes to be working, we're increasing our insulin production, and that just is destructive to our physiology in the long haul. I mean, it doesn't need to be done. I mentioned that I traveled around the world, and this was back in 2007, and part of our visits were in France. We did a home exchange there. We stayed in a little village in France called Nocelle. It's in the southern area of France. And what I noticed is in this village is like, okay, well, if you haven't eaten by 12 or 1 o'clock, look, you're not going to eat till 7 p.m. or 6 or 7 p.m. when the restaurants open up again. And so there's no way, like unless you have, you're cooking on your own or whatever, but the restaurants will not serve you in between. And so I found like, that's why everyone here looks so healthy. Plus they're walking everywhere and everything else, but there's no snacking built into their society at all. It's just not part of it.
Yep. I think that's huge. That's a big, big deal. And that is one of the things where I think as Americans, I see a lot in my clients that'll come to me. And one of the first things I tell them is don't snack. You got to stop the snacking. And they just can't understand that because, we are often told, especially as women trying to lose weight, 6 small meals a day, right? Like you're praised for grazing all day long versus sitting down and eating a big satiating meal.
Right, exactly true. And we've been told 3 meals, 3 snacks, right?
Yep.
Well, who is that for? The endurance athlete, maybe? Maybe the endurance athlete, but I haven't met any woman. And the other falsity is women with adrenal hypofunction or adrenal fatigue, for lack of a better term. They're often told, no, you have to eat throughout the day. I disagree completely. I disagree. I've worked with women with, baseline cortisols, baseline DHEA, and I was one of them, right? I had a significant amount of trauma and PTSD. I was one of them. No, this enhances our physiology and creates a resilient physiology. We have to stop snacking, and that's how we build up our adrenals.
I love that. Okay. And then kind of on that same vein then, Dr. Anna, let's talk a little bit about thyroid health, because that's the other thing we hear is you're going to wreck your adrenals. And then if you're a woman, especially, you probably should not be doing the keto diet, or at least not long-term, because you are going to wreck your thyroid. So can you talk a little bit to that, and how do you feel about that? What's your game plan?
Yeah, actually, I've been published in First for Women magazine and Women's Day magazine talking about this exact issue. It's a big issue on everyone's mind. But in my Keto-Green, now we don't do straight keto, we do Keto-Green, we do intermittent fasting. We are, I'm getting women to check their urine and improve their physiology, right? And this is in our most difficult weight loss resistant group of women, those of us 40 to 60, let's say. So this is really critical. What I've seen are improvements in thyroid function, improvements in TSH, improvements in free T3 to free T4 conversion. So, or free T4 to free T3 conversion. And so I've seen these improvements over time, not the other way around. I've also seen hemoglobin A1C decrease significantly. We have one client in my new book, Keto-Green 16. We've been running this. You would love this, Jessica. Oh my gosh, I know you're going to be all over this. We were running this program we started running it in the fall as I started creating my Keto-Green 16 guidelines. And so we've run out of a medical clinic, Dr. Angela Akey's medical clinic in North Florida by the University of Florida. We've run my Keto-Green 16 group plan. So I think what I'm really excited about, the Keto-Green 16 can be done in groups, like how we're doing our Bible in a year. We do Keto-Green 16, like the first 16 days of every month, but bring it into our workplace, bring it into our small groups. Let's do it together so we have community around this, because there's so much healing in community. So we've been doing this as a pilot study in North Florida. And what we've seen is in one individual, for instance, she is 50 years old. She's had a hemoglobin A1C of 6.0 for a decade, has diabetes on both sides of her family, has a definite strong genetic predisposition to it. But in 1 month following this plan, I made her do 2 rounds of Keto-Green 16. But in 1 month, we saw a drop in her hemoglobin A1C from 6.0 to 5.4.
Wow.
In 1 month. I mean, typically we say it takes 2 months to see something in your labs. No, but we saw it in 1 month, and we've seen it over and over again. My hemoglobin A1C was as much as 5.7. It's now down to 4.8, and I'm 53 years old with diabetes and heart disease on both sides of my family. So and that is a huge marker. The higher our hemoglobin A1C is, above 5.3, we know that our risk of Alzheimer's and dementia increases exponentially. Yeah. So even though we're not diabetic till we're like above 6 or pre-diabetic at 6, we are on that trajectory. And we need to flip that around and improve the quality of our life and our health sooner rather than later. And we can do this ourselves. We can watch our own hemoglobin A1C. We can change our diet and lifestyle so that we're enhancing our physiology and strengthening our body and our insulin sensitivity and our increasing our quality of life. We can do that by ourselves.
Yes,
in a group.
That's awesome. So I kind of along those same lines, you got me thinking about this. So what about cholesterol? What about the woman who is worried, or or maybe she doesn't think she has to be worried, but she goes in to see her doctor and her doctor says, you're going to kill yourself if you do this. You cannot, this is going to raise your cholesterol. We're going to have to put you on a statin. Talk to us a little bit about that.
Yeah, I've been doing this. I've been doing my own program now. So, and I've had clients doing it for over 5 years now, and we have not seen that. Now you have the ApoE genotype, right? So with that, and I would say if someone's doctor says that to them, say, well, then test me and monitor me. Mm-hmm. Now it may go up transiently initially, but follow it, because and if you're measuring, you're getting into ketosis through the way I recommend and draw it in my books, as well as you're checking your pH and you're getting alkaline, you're enhancing your physiology. Now, the exception here may be the ApoE phenotype, right? We know they have a higher risk of Alzheimer's, higher cholesterol, but what you have to do then is definitely switch from MCT oil to using more olive oil instead. So the healthy plant-based oils instead, so we can fine tune it there. In Keto-Green 16, I have a 16-day omnivore plan and a 16-day vegan plan. So you can switch it up, right? You can modify that, but we want to make sure you're getting these healthy fats and see that makes a difference. The second thing I want to tell that patient is that we need to break down the cholesterol. What is the particle size of the LDL, which really matters? Large and fluffy, that's type A. That's perfect. That's fine. For the most part, we're not worried about that, even at higher than optimal levels. So, but if it's particle size B, we've got to do other things. And often we're adding on omega-3 fish oils. We're adding on CoQ10. We're, using increased dietary and lifestyle habits and changes to bring that cholesterol to a healthier level. And I've seen that shift over and over. I've seen people go from type B cholesterol pattern to type A cholesterol pattern following my program. And that's key. That's beautiful. We want to see that. So I say, try it, see how you feel, monitor, test, and don't just look at total cholesterol. Look at the breakdown. We call it the complete the cardiovascular cardiolipid panel. Mm-hmm. So look at the complete breakdown, not just LDL, HDL, and total cholesterol. We want to know apolipoprotein A. We want to look at particle size. All of that makes a big difference in how we talk about someone's cholesterol. So that's really a key part. But plus, look at even more important, or as important, look at your inflammatory markers, your HSCRP, look at your hemoglobin A1C, measure your adrenal function. Mm-hmm. Those are things that just shift the trajectory of your health even more. And I've seen that improve in all cases that I've worked with.
Mm-hmm. Yeah, I think that's important. Just really important. I wanted you to touch on that because I think women get really afraid of that. And I think it's important for women too to understand that our hormones, we need cholesterol. We need these healthy fats. And if we're cutting these out or stopping our body's ability, which produces 70 to 80% of the cholesterol in our body anyway, we produce it ourselves. If we're trying to stop our body from doing that by being on a statin or cutting out fats because we're afraid of them, then we're really just damaging ourselves. We're stopping our body from being able to even be hormone healthy because we can't even produce the hormones we need.
So true. Yep. So true. And we know that people who are on statin medication, we know from a study actually way back in 2010 that looked at, I think it was 1,000 Italian men who were on statin medication, and those compared to those who were not. And those who were on statin medications had significantly lower testosterone, which makes sense because, again, our hormones are derived from cholesterol.
Mm-hmm. That's a good point. I love it. Okay. Well, I guess I want to wrap up here, so be respectful of your time here. I know you're very, very busy. But I want to give people an opportunity to find out where they can find out more about you. Do you take clients? Like, I'm assuming that I'm going to have women listening to this and they're going, oh my gosh, this is the OBGYN I need. Like, where has she been my whole life? So do you work with clients? Are there ways that they can get a hold of you? Kind of give us all of that good stuff.
Yeah, well, I definitely say just join me at my website at dranna.com. Like, so Dranna, DRANNA.com, and definitely get my books. I mean, it's everything I want you to know as a patient, as a client, as a woman, and I want you to know this for your family. So definitely connect with me there. I do online programs and online coaching. So that's currently the way I'm running my clinical practice. We have a waiting list right now for new clients. But for anyone coming on can start one of my virtual programs, and that's how we start in. And then certainly, of course, on social media, all over the place on social. And then we have that link too for the keto calculator.
Okay, awesome. Yes, and I took mine, and it sent me. I wanted to tell those listening. What I love about this is I have my little. I've got. I don't know if everybody can see that, but I got a little email here from you, and it tells me I calculated mine based on my age, height, weight, and then I told it that I wanted to lose weight, kind of because I wanted to see what it told me I needed to eat for calories, because I'm very particular about that with my clients. Because women, so often we're cutting calories and we're not eating enough for our bodies. And that drives me crazy. So I really wanted to see what it told me. And it told me that if I want to lose weight, I need to try to eat little over 1,900 calories a day, which I love that. At least it did not come back and tell me that I need to eat 1,100 calories a day, which, oh, I can't tell you how many people think that they need to be eating that. But then it tells me, my 140 grams of fat, 121 grams of protein, 40 grams of carbs, and then it explains all of it. So I really love this. And then it even comes up with a little meal plan, and this is great. So this is a really good tool to have. It's great for women, especially because we come to this and then we go, well, you're telling me, like, it might be a little overwhelming when they start working with me, I'm assuming, because I try to not, feed them through a fire hose, but at the same time, I'm like, you need to have more calories. I want to see more fat. You need to get your stress under control. By the time they're done with the phone call with me, they're probably like, my stress is out of control. And it's really scary to start eating, 1,900 calories, for instance, when we have thought that in order to lose weight, I need to eat 900 calories or 1,000 calories.
Mm-hmm, mm-hmm. Yeah, it's so true. And that we need to, like, when we're doing it this way, our body is well nourished. And I like Dr. Gabrielle Lyons said, we're not over fat, we're under muscled. We're under muscled, and we need protein to increase our muscle. So that's also why I created, a Keto-Green protein shake too, because often, like, I'm not getting enough protein in my diet. I'm all over the healthy fats, with avocado, with olive oil, and smoked salmon. Like, I am so good with that stuff, right? I've got that down now, after like recovering from the low fat of my youth that I'd been told. So I'm a reformed fat eater, healthy fat eater. But getting enough protein is a challenge. And also, I was a vegetarian for many years. Getting enough protein is a really big challenge. So I recognize that, especially as I'm older, and it's harder to maintain muscles, even with, again, it takes more than hormones to fix our hormones. Even with optimized hormone numbers, we have to do these lifestyle hacks and nourish our body in many ways so that we are maintaining our bone, our muscle, our brain, all of those things I was losing now. What was that? 5-6 years ago.
Yeah, that's great. I love that. Yeah, we need more protein as we get older, and it's something that is difficult. It can sometimes be difficult for women to get in. We don't feel like we want to eat it all, or we just can't. It's hard to change that. We have to have a real paradigm shift, and it's really hard sometimes to get over that. So a shake is easy. Like, women think, okay, that's great. I can do a protein shake. Like, I can handle that.
Yes. Yeah. That sounds good.
All right. Well, thank you so much for being here with us today, Dr. Anna. It has been wonderful. I love your book, The Hormone Fix. I love Keto-Green 16. I think this is going to really help a lot of people out there. So, and I will put links to all of this in the show notes so everybody will have an easy way to be able to grab that.
Thank you. And we have a lot of bonuses that go on it. So even if we're, the book releases May 5th, But we have bonuses to get started, including the quick start guide, the roadmap, some additional recipes to get you kick started too.
That's awesome. Thank you so much.